Jane is a 30-year-old woman living in Kingston. She can't work due to a physical disability, and she occasionally has difficulty paying for her utilities. She struggles with mental illness often and is looking for support to make ends meet, but just doesn't know where to find it. Jane is just one of the dozens of people who responded to our housing waitlist survey, yet represents many of those in our community hoping to gain access to affordable housing in Kingston. The goal of our project was to identify the needs of Jane and others like her, to identify specific issues that could lessen the strain on the City of Kingston's subsidized housing waitlist. Who are we? We are a multidisciplinary team of PhD candidates from Queen's University, supported by our mentor, Susan Wilcox, who has a doctorate in adult and higher education. We participated in this project as part of the Queen's PhD Community Initiative, which was conceived by the School of Graduate Studies in 2016 and aims to foster important community connections that generate innovative solutions. Work in the subsidized housing area began last year, and a report was developed with the City of Kingston on the state of social and supportive housing. To build off of this momentum, our team was organized to look into the difficult issue of social housing waitlists and identify areas of improvement. There are over 1,300 people on the subsidized housing waitlist in Kingston, and the average wait time is several years. It's obvious why this statement is problematic, and it's not limited to Kingston alone. Canada is undeniably going through a homelessness crisis, and has been since at least the 1980s. There are vastly insufficient funds available to build even a fraction of the supporting housing units needed, or to provide the financial support to subsidize rental costs. Despite this, it's widely recognized that adequate housing is a core social determinant of health and is fundamentally interconnected with other crucial social issues, like unemployment, mental health, and addiction. Studies have shown that providing affordable or supportive housing has a positive feedback effect upon these interconnected issues. Upon meeting with the City of Kingston to discuss how we could address this issue, it became apparent that they had a lack of information on the demographics of those currently on the subsidized housing waitlist, and were, therefore, at a loss for how to best help this population. Therefore, the aim of our project was to assess the demographics and needs of those on the housing waitlist in Kingston in order to, hopefully, provide effective recommendations moving forward. In consultation with the city, we developed a survey to capture this information, which was widely distributed and then assessed for significant data and trends. The survey items were constructed using guidelines for effective item writing, using clear statements and short and simple questions that were relevant and easily interpreted. 19 questions were asked to respondents concerning demographic information and social determinants of health, along with space to provide any additional information they wanted to offer. An invitation email with the survey link was sent directly to persons on the waitlist by the City of Kingston. Before giving consent, participants were informed that the survey was anonymous, voluntary, and had no impact on their eligibility to access subsidized housing or other risks. Upon completing the survey, each participant was provided with a $10 electronic gift card to Tim Hortons. In total, we collected 100 responses for further data analysis, 7 of which did not complete the majority of the survey questions, leaving us with a usable sample population of 93 participants. Most of our participants, at 72%, identified as female, while the rest identified as male or other. 70% of participants were between 25 and 65 years old, a smaller percentage at 20% were seniors, and only 10% were under the age of 25. More than half of our sample had no dependents, the majority being single people with no dependents. Respondents with dependents were also largely single. Next, most respondents were Canadian citizens and of white ethnicity. In terms of working status, participants mainly identified as either unemployed at 43% or retired at 28%. The rest of the participants identified as either being part-time employed, students, or full-time employed. Most of those unemployed were between 25 and 65 years old, and around 18% of them were under 25 years old. Most of those who identified as being retired were over 65 years old. Among the unemployed, about half were staying with family, and the other half were paying full market rent. What became apparent from this data was that respondents had many issues other than the inability to pay rent, which could be compounding this problem. Concerns about living conditions in unsafe neighborhoods were commonly cited concerns, and main reasons that people wanted to seek new living arrangements. Issues raised by participants included a lack of priority for victims of domestic violence, as well as accessibility concerns in their homes, especially for those with wheelchairs. Mental health was an overarching issue for most respondents, with about 75% of participants expressing mental health-related concerns. Participants noted that they found the waitlist application process too confusing, with many having applied multiple times or missing annual check-ins, which could compromise their position on the waitlist. Participants also expressed frustration with the length of the waitlist, expressing how, even with social assistance, they could not afford to pay market rent, with over 50% of those that pay market rent expressing a desire for rent subsidies. This is a graphical representation of our findings, highlighting how the majority of participants struggle with mental health concerns, up to 75%, as shown by the graph on the left. In the middle graph, you can see how most respondents were unemployed at the time of the survey, at 43%. The rightmost graph illustrates how half of the respondents had applied to the waitlist multiple times, demonstrating how this process can be confusing. Being aware of these concerns and the demographic information of these respondents is crucial to the effective recommendation of strategies moving forward. From this data, we have brainstormed several recommendations, which can hopefully be applied to target the specific areas of concern addressed by our respondents. Issues relating to housing structure and financial issues help realize the need for increased accessibility and maintenance of homes, along with providing assistance for managing debt. Encouraging the application for utility subsidies could also be a benefit, as many struggle to pay these bills on time. Communication issues included the need for greater awareness of private housing options in Kingston that respondents could apply for, along with the need for more avenues for those on the waitlist to share their stories and concerns, such as having focus groups. Better protocols also need to be in place to assist with the waitlist application process and annual check-ins, which could include increased support and reminders. Finally, overarching systemic issues included mental health concerns, safety issues, and increased support for seniors and victims of abuse. Making sure that resources are in place and accessible to help these vulnerable populations is of critical importance. Thank you to the School of Graduate Studies and the City of Kingston for providing us with this unique opportunity to get involved with our community as part of an interdisciplinary team. We hope that this research and these recommendations will be useful moving forward and provide an important jumping-off point should this project continue next year, which of course we hope it will. Thank you so much for listening, and feel free to reach out if you have any questions.